Bonjour à tous, bienvenue à cette conférence de presse.
So welcome to this press conference. Today, the Premier of Quebec, Mr. François Legault, is together with Minister of Health and Social Services, Mr. Christian Dubé, the Minister delegated to Transport and Minister responsible for the metropolis and the Montreal region, Chantal Rouleau, and the National Director of Public Health, Mr. Horacio Arruda. Mr. Legault. Yes, so hello everyone. Happy to be in Montreal and to see you again. Today, we want to talk to you about masks. First, we've had a lot of opening of services, businesses, enterprises in the past few weeks, and honestly, things are going well. So when we look at the number of cases, the number of hospitalizations, the number of deaths, we see that there is a constant decrease in the numbers, which is encouraging. But we must be prudent. We must be prudent when we look, for example, at what is going on with our southern neighbors. I'm thinking, for example, about the state of Florida that Quebecers know very well, but California, Texas. We thought that in those states, the spread of the virus was under control. But we've seen in the past week or two that there is a very strong upsurge and an increase in the number of cases for all sorts of reasons, but essentially because people gather more and have contaminated one another. So we see that in certain states of the United States, they have to reconfine, so put restrictions in bars, for example. I think that it's something that we also see in Quebec. It's difficult to respect the 2-meter distance, particularly after a few drinks. That's what I've been told. So very, very important to respect the guidelines. The last thing we want in Quebec is to have to come back to where we were a few months ago. So to come back in a situation where we'd have to reconfine, where we'd have to take a step back and put restrictions, close businesses and companies. No one wants that, I think. Of course, and I've said it often, and it has been shown, since the beginning of the crisis, Quebecers have been extraordinary. It is here. And we're not saying it just to say, there were apps that showed us. It is here in Quebec that people were the most careful. It is here that they most respected the guidelines. When we look at the 60 states and provinces in North America, it is here that people followed the guidelines the best. And since we started opening back up, the companies, businesses, different services offered to the population, well, the word of the day that we gave ourselves is to go progressively. That is the one word. What I've repeated the most often in the past few weeks is to go progressively. So let's remember, first we ask people to stay at home, that people only go out to go to the pharmacy or grocery store or to go get an essential service. And after, we opened up more services gradually. We set up a guideline where we recommended the use of the masks. So on that side as well, we went gradually in the recommendation of the usage of a mask when the 2-meter distance cannot be respected. I think that we all realize that we are more prudent. It's sometimes a bit odd to see friends that we haven't seen for a long time and to stay 2 meters away. It's not always easy, but we can see that habits are changing. And when we set up the mask measure, we asked that it be worn in those places where there's a lot of people, amongst other places, public transportation. We made an operation that we launched from here with the Mayor of Montreal, Valérie Plante, whom I wish to thank. I also wish to thank all the public transportation companies that distributed masks, that made sure that this recommendation was followed. So we went progressively with this. But of course, the more we reopen businesses and stores, the more people there are in public transportation, in the metro, on the buses. And now I think that we are at a new stage. And of course, we've said it often, there are changes, but it's an evolution. And there will continue to have this evolution. So today we're now at a new stage, and that is why I'm announcing today that as of the 13th of July, so not this coming Monday, but the following, masks will be mandatory in public transportation. There won't be police officers, but we will be asking people who manage the public transportation to not let people go in to not let people without a mask go in to the public transportation. So I think this is where we're at, and it's a question of respect. A mask is a lot more to protect others than to protect ourselves. So it's a question of respecting other people to wear it. So it's not a question, I hear sometimes people say, or say those who don't have, who wear masks, that they're, scaredy cats or whatever, but that's not the idea. A person wears a mask because that person respects others. In case that they are infected, they don't want to infect other Quebecers. So it truly is a question of respect. So the rules or this regulation is going to apply to everybody who is 12 and over. So in all public transportation in all regions of Quebec. For children 12 years and over. For children younger, it will be recommended, even strongly recommended, but not mandatory for children from 2 to 12. And as far as of the children 2 years and under, there is a risk in wearing a mask for those children, so it is not recommended. So children 2 years and under don't wear masks. We don't want to make it complicated for nothing, but from 2 to 12, strongly recommended but not mandatory, 12 years and over, mandatory. Now, of course, we are going to leave a period of transition. So we're going to be asking public transportation corporations as of the 13th of July to let everyone know that it is now mandatory, but we'll leave a 2-week period, so until the 27th of July, before we start forbidding people without a mask to actually go on buses and metro. So we'll give people the opportunity during that 2-week period to get masks. We'll try to help in supplying masks to certain places, as we have done, but as of the 27th of July, people will no longer be able to get on public transportation if they're not wearing a mask. There are people who will be asking, okay, you're making the mask mandatory in public transportation. What about stores? What about public places where there's a lot of people? Well, we continue strongly recommending their use, but for the time being, I am saying for the time being, it is not mandatory. We are not excluding to make the mask mandatory in places other than public transportation. A lot of factors will be taken into account for this decision, including the evolution in the number of cases and the evolution of the pandemic. But as well, we want to go progressively. I think that one of the reasons why we have succeeded well in Quebec is because we went progressively. We didn't start setting up 12 measures all at once. We did things progressively. People get used to things progressively. So for businesses and public places, for the time being, it is strongly recommended to wear a mask, but it is not mandatory. I would like to conclude by saying that I understand that it isn't pleasant to wear a mask, particularly in the summer. It's hot. With a mask, it's even warmer. It's not pleasant. But at the same time, it's necessary if we don't want to have to come back, if we don't want to have to reconfine ourselves, and we don't want to see what's happening in certain states in the United States happen here. Well, in order to avoid that, it's important to take precautions, and we have to do that by respecting others. So I ask all Quebecers, out of respect for other Quebecers, to please wear a mask when you are in public transportation. As you know, COVID-19 is dangerous. It's serious. There are still deaths. It's relatively easy to catch COVID-19 from another person who's too close. So let's be smarter than the virus. I would like to end by saying that when we wear a mask, we're not scaredy cats, we're just very respectful. So thank you very much, everyone ahead of time, for your understanding.
Quebecers have been extraordinary in the last few months. It's in Quebec that people have been the most careful and have respected public health instruction the most. But we must stay careful. We don't want to see the contagion restart as we're seeing in many states in the US. We don't want to be forced to go back to a lockdown. That's why we've reopened progressively in the last weeks, but there are more and more people in public transports, and we're now in a new phase. I'm announcing today that wearing a mask will be mandatory in public transports starting July the 13th. Those not wearing a mask won't be allowed in public transports. This applies for everyone above the age of 12. For children between 2 and 12, we recommend a mask, but it's not mandatory. And children under 2 years old shouldn't wear a mask. As for shops and in other public places, we continue to strongly recommend wearing a mask. But for now, we won't make it mandatory, but this could change. Let's be clear, wearing a mask is not about fear, it's about respect. Wearing a mask protects other people in case we're infected. So I ask every Quebecers to follow the public health instruction out of respect for each other. Thank you.
On va débuter la période de questions. Vu le nombre important de journalistes, je vous demanderai de vous limiter à une question.
We will now be starting with the question period.
Oui, bonjour Monsieur Legault. Question précisément pour vous.
A question for you, Mr. Premier. You gave an interview to my colleague on the 12th of June, to my colleague, and I quote you, about the obligation of making the mask mandatory. I could make it. I'm the one who decides. I would do it if I think that it's a good thing, but I don't think that it's a good thing. So what has changed since the 12th of June that makes you think that now it's mandatory? I think I had been clear, but I'll repeat what I said. What I was saying earlier on is that we have to go progressively. And obviously today, there's a lot more people using public transportation than at the time when I said what you quoted me for. So we've seen it throughout the pandemic. Things evolve, and the rules evolve depending on the context and depending also on the pandemic, and depending on what is going on with our neighbors as well. So today, we feel that need to go one step further. So just to understand specifically the increase in the number of people is what explains it. It's a series of reasons. A few months we asked people to stay at home. I have not changed my mind on that. At the time, it was what was best. Now we have started in the past few weeks to open things back up. We can see that there are people who don't wear a mask in public transportation. We can see that there are more and more people using it. We see that in certain states, I don't know if we're talking about a return of the first wave or a second wave, but we can see an increase in the number of cases, and we wish to go progressively. So, and I was saying it, it's possible that in 2 weeks' time you come and tell me, Mr. Legault, you said to not wear, that the mask was not mandatory in businesses, and now you're telling us that it's mandatory. Well, that's possible too. It's not because we are changing our minds, doing a 180. It's because the situation evolves and we have to go progressively with things.
Bonjour, Monsieur Legault. Bonjour à tous.
Bonjour.
Monsieur Legault,
Mr. Legault, you told us earlier that the situation was still dangerous, that there was still danger around. Now, if I understand correctly, we're waiting 2 weeks before setting this up, 2 weeks before making it completely mandatory. If it's dangerous, why wait for an entire month? Well, we could have also told you that we're doing it in September when it's back to school, but it's also a question of, there's not, black or white answer here. It's just a question of giving people the time to get used to it. We're announcing it now for in 2 weeks' time. And in 2 weeks, the authorities of the public transportation corporations will be telling people, listen, next time, you won't be allowed in. So I think it's a question. The answer is to go gradually. A question on the free trade agreement that is coming into effect tomorrow. How do you act? How do you see that for aluminum, the sanctions? Ooh, that's a big question. First, I prefer having an agreement with the United States and Mexico than no agreement at all. We remember that Canada, and Quebec in particular, exports a lot more to the United States than we import. So we have a commercial balance that is positive. It's about the only country with whom we have a positive commercial balance. So we have a lot more to lose without exchanges. Now, concerning the aluminum, we've tried to fight to avoid that the aluminum from China goes in directly to the United States, because that is what the problem is right now. The overcapacity comes from aluminum that indirectly makes its way from China. I talked about it with Justin Trudeau last week. I think that we have to be relatively firm with the United States. We have to use all the legal possibilities that are available to us. That is, do we have to think, despite the new agreement about taxing new U.S. products that might come into Canada in exchange of this tariff on aluminum? Well, the first choice, obviously, is that there not be tariff on aluminum. Of course, there are elections coming up in November, so we'll be following the results. But of course, it would really hurt us. And I've asked the federal government to be very hard towards the United States in order to avoid this tariff on aluminum. We saw the images over the weekend of people swimming. How do you react when you see that earlier on you talked about how disciplined Quebecers were, that they respected the rules? We can see that it's not necessarily the case, for the case of the beach in Rouleau, people not wearing a mask, big crowds. How do you react to that? Well, it's worrisome, but it's a psychological question as well. When we look back to March or April, people were doing more rather than less because they were scared. But now it would seem that there are some people who are not as scared, who look at the number of hospitalizations going down, the number of cases, look at the number of deaths, and they think, oh, there's no danger anymore. We just have to be prudent. And I don't like to see that. People who don't respect the 2-meter distance, whether it be in Rouleau or whether it be in a bar. I don't like it. And I think that one of the reasons as well for what we are announcing today is to tell people, be careful. We are adding a guideline now where we say that the mask as of now will be mandatory in public transportation. It's not ungrounded. It's because we're saying that there is a possibility for a second wave, and be careful. So we're going to have to work hard, me first, and I'm telling Quebecers, do not do what happened in Rouleau. Very dangerous. Look at what happened in California. There was a party, I think, the Memorial Day, and all of a sudden the cases just exploded. So the virus is still there. We can't participate in activities where we are less than 2 meters away from others. The virus is still lurking around. A question that I find intriguing. You know very well that the public in general received a lot of contradictory messages concerning the mask. At first it was not recommended, then it was recommended, and then it was strongly recommended, and now it's going to be mandatory. But not in businesses yet. Just yesterday, Dr. New in Ottawa said that I prefer that people be encouraged rather than regulated into wearing it because they fear for some kind of reaction. What should we do so that people understand the message despite all the contradictory messages on the one hand, and also starting on the 27th of July, physically what will take place on a bus when somebody shows up and they are recalcitrant? You know it's going to happen. It's inevitable. It will take place in the metro. It will take place on the bus and in regional buses as well, further away. What do we do physically then? Well, first, as far as the evolution of the guidelines is concerned, it is normal that there is an evolution in the guidelines. We weren't going to require that everybody wear a mask when everybody was at home. So, of course, the more we open, the more there's a risk, the more we add guidelines. That's normal. It's an evolution. And it will continue being done. First, we want to go progressively. Second, we also wish to take into account the situation and the evolution in the number of cases here, but also with our neighbors elsewhere in the world. Is there a second wave? Or is it the first wave, peeping up again? The specialists don't necessarily agree on that. But as far as the regulations are concerned, we ask public transportation corporations. Somebody was telling me an example yesterday, and they'll recognize themselves. If somebody wants to go on a bus with a sofa, the bus is not going to let them go in with a sofa on a bus. Well, as of now, you can't go on a bus if you're not wearing a mask, as of the 27th of July. But how will you put that in effect? Bus drivers are not police officers. They're not, bodyguards. They're not, well, there's rules. The rules have to be respected. If somebody goes on the bus, they pay, they get a ticket, or they have a ticket or a pass, and there's a rule now called wearing a mask. Let's say that the person goes on the bus and in the metro with their mask, or there's somebody in public transportation that removes it and doesn't wear it. In what way are the consequences going to be managed? Who will be applying them? And also, the mayor was talking about the fact that what are we going to do for those who don't have them? Are we going to give them some? You mentioned that there was a possibility of distributing it. What will be your approach? Well, a mask is a few dollars. We've given some out and we'll continue giving some. We have reserves, and we're seeing that public transportation corporations, those that have them, those that bought them, will try to help them, especially in the first few weeks. But at the same time, I count on the responsibility of Quebecers. I think that in Quebec, we show solidarity toward others, we are respectful, and I think that that is what is the strongest. But just to say that it's mandatory is already a message. That means that even a citizen, when faced with another citizen, can say to the other citizen, hey, it's mandatory to wear a mask. What I mean is the fact that it is mandatory, we're not going to send an army or hundreds of thousands of police officers to check. But what I mean is, I think, too, that there's a question of responsibility, and we're saying it's mandatory. Of course, it's going to be easier at the entry to the metro because there are people who can see before going into the metro. Perhaps it might be a little bit more complicated in taxis. But I think that taxi drivers and Uber, I think it's a question of protecting themselves as well to require that passengers wear a mask. I think it's a question of respect. Will there be a fine? Would there be a possibility of a fine? No, there's no fine. The only negative consequence is to not have access. Question on the tramway. is it for our colleagues in Quebec? Essentially, we know that to respect, the $3.3 billion, Quebec wanted to let go of the idea of the tram bus that was supposed to cost $580 million to circulate from east to west in the lower end of town. The problem is the tram is more expensive than planned. And you insisted that the budget be respected. Is the new version of the project still being supported on your end? Because you are essentially the main payer for this project. Well, I spoke with Régime Labaume last week about this situation. I asked him to give us a certain amount of time to study the new project. If you recall, in 2018, the CAQ had asked, before supporting the project, that the outskirts of Quebec be well served, because it's important. You can't just have the tramway in the middle. All the outskirts have to have the service as well. So what I asked Régis Labaume is to give us a little bit of time to analyze how the outskirts were going to be served. So he said that he had the support of the mayors of the suburbs, and he was they were satisfied with the service, and that the new project did not change much to how the suburbs were served. So we'll take some time to study the new project, but for me, it is a condition that remains important and mandatory, actually. The suburbs in Quebec have to have the service. The European Union has announced that it will open its borders to Canadians. There may be a lot of Quebecers today who are reconsidering the possibility of going on vacation to Europe and France. What are you telling them today? Listen, you have to understand that we have to look at the epidemiological situation over there in terms of transmission. And I can tell you that with the reopening, we'll be evaluating to check whether we're not going to be asking people to stay quarantined for 14 days. There will be discussions with the federal government, obviously, because the Quarantine Act is under its jurisdiction. But if needed in Quebec, we could require an extra quarantine if it's not done by Ottawa, with a perspective where the conditions of the World Health Organization, one of the conditions is to decrease the importation of external cases. We're also worried by the U.S. border because we know that in the eastern states, all the way down to Florida, there's a tremendous amount of cases. So these are discussions that we're having with our minister and the premier, and we'll see what the decisions are made by the federal government and what will be our contingency plan to avoid a massive introduction of cases imported by other countries.
Je viens de lire quelques commentaires sur les réseaux sociaux de gens qui...
I saw on social network there are people who say that perhaps they don't want to use public transportation because they would have to wear a mask. Do you think that it will be possibly reduce the ridership in public transportation to make the mask mandatory? I hope not, but I don't think so. I think those will be exceptions. People who will be saying, if I have to wear a mask, I'm not going to use public transportation, I'm going to take my car, I think it's going to be minimal.
Bonjour, François Carabin du journal Métro. Bonjour à tous. Ma question s'adresse au...
My question is to Dr. Arruda. Recently, we've heard of studies from the National Institute of Public Health that came out with modelizations in the number of significant contacts that we have with other Quebecers and that we have had since the beginning of the deconfinement period. Before the pandemic, it was evaluated as being 12 during confinement to about 4. Are you able today to say where we are at? And I know that very often the number of 8+ meant a second wave. So how is it that we're not in a second wave? Well, there are many factors. These are elements You have to understand that the factors that generate a second wave are multiple ones. That is one element. But what we've noticed since the deconfinement period, without us having increased the number of hospitalized cases or the death toll, every time there's a case, there's a few more contacts. That's what we've noticed. So compared to the time when people were confined, a case could generate 2 or 3 significant contacts, whereas now we notice pretty much everywhere in Quebec that there's an increase of that. It's not dramatic yet, but it is an indicator that tells us that people are moving around more, etc. And I want to insist, and the Premier has done so, wearing a mask, the face covering right now, must become a social standard and a norm. As long as we are in a period of non-normality, because we know that the 2-meter distancing is the thing to do, but we also know that in everyday life we are brought to very often be with less than 2 meters between us and other people. That is why, you wear a face covering, you protect others. The others wear a face covering, they protect you. That is in addition to respiratory hygiene. So distancing, wearing a mask, washing your hands, these are things that have to be done. And otherwise, we'll end up in situations where we'll have upsurges again and we'll have to reconfine sectors because we are deconfined, but like in parole, that is what I was saying. There are conditions to be respected. Let's think about bars, for example. If people, if it becomes outbreak clusters, we'll have to intervene and close them. I think that people have to understand that. Don't wait to be forced to wear the face covering. I wear it, it's when you go outside with your keys. You should always have your face covering with you to be ready in case there are contacts in less than 2 meters. So in the development of vaccine, I know we're not there yet throughout the world. We're still at clinical trials in most cases. This being said, with a perspective where a vaccine would be developed for COVID-19, perhaps it could be addressed to Mr. Dubé or Mr. Legault as well. Is there a world where we could make vaccination mandatory to make sure that a population of a sufficiently high number in the population is vaccinated? Well, in fact, we have to understand that it depends on the quality of the vaccine. It will depend on the objective of vaccinating. For example, let's say for the flu, we don't vaccinate everybody. We vaccinate the people who are at higher risk of getting complication. If we look at the behavior of the coronavirus right now in children, for example, and we see that in children there's no, they don't contaminate others and they don't have serious consequences, the strategy that would be used, depending on the immunity as well, is to vaccinate the elderly people, people with chronic diseases, people who have immunity diseases and deficiencies. That would be most logic, especially when we are developing a vaccine and the quantity initially will be a little limited because all countries are going to want to have this vaccine. So it's going to depend on the results. Will the vaccine protect the elderly or not because they'll be able to develop immunity? I mean, it's going to depend on the quality of the vaccine. It's too early to say anything. But I would say that a good hypothesis is that we would vaccinate people at high risk. We will now go to English questions.
Elizabeth Zogalis, CJD. Excuse me. You mentioned before that you don't want hundreds of police officers inside the stations or bus stops to police this new rule. The STM union says they don't want to have their drivers have to enforce it. So how exactly will the new law be enforced?
Okay, we expect the transport commissions, the different societies of transport, to apply the rule. So I understand, and I'm not surprised of what you're saying, but we expect them to apply the new rule.
But will there be any kind of fines, or how is it going to work if someone wants to get onto the bus, but the bus driver says, well, I'm not dealing with this?
Yeah, but what would happen if the unions say, I start not collecting any more money or not assuring that we have a pass or whatsoever? I think it has to be a rule, yeah.
We'll go with Giuseppe Valiente, Canadian Press.
Good midday to to everyone. Just to retake the question of my colleague, so I just want to confirm if you can confirm about the enforcement in English. So there will be no police enforcing this whatsoever on buses or on metro. There'll be no tickets, no fines. If you manage to get inside a metro with no one's at the door, you're in the metro, you don't have a mask, metro security won't be able to fine you. They'll just have to they'll ask you to leave. I mean, can you just go into detail, please?
Yeah. The rule will be that the only consequence will be that you cannot use the transport. There's no fine, any amount of money to be payable, but you won't have access. And I understand that in the metro, of course, you can wear a mask when you get in, and then you can change your mind and not wear the mask. But we also need to count on the respect and solidarity of the population, because the goal is to protect other people. So I think people not wearing a mask would show a lack of respect, and I think that in Quebec, it's not something you want to show.
And Dr. Arruda, just on a personal note, these past few months have been quite difficult in general. I would imagine you've been quite busy. In anticipation of a possible rise in infections in the fall, are you planning on taking a break, and how do you plan on recharging your batteries, so to speak, and what advice would you give other people in the government to do the same?
In fact, I've been asked by my minister to take vacation, so I will be...
What about me? Yeah.
And the Prime Minister too, but my direct boss is my minister. So I will be in Quebec. It's clear I'm going to be like I was in Morocco, with my phone and checking what was going on, ready to come back anytime. That's clear. But I will do that, and I always try to be on vacation too, sleeping well if possible, to maintain the rhythm. So listening to music and do things that is good, bicycle and sports. So it's what I recommend, but I will tell you that I will wear the mask when I'm going to be, even in vacation, when I'm going to be in risk of being into 3 meters. So I think it's a very important message today. We are making it mandatory in transportation, but why wait? If you want to protect yourself and others, please use your mask even in vacation. And there is new styles of masks that can match even your bad suit.
We'll take the next one.
Jay Termel from CBC. I'll read you a bit of a tweet here. Well, it's regarding the testing. I think we're down to about 6,000 people per day. The numbers are going down. The number of infections are going down, of course, because it seems like we're testing fewer people, almost like the Donald Trump pattern of the fewer we test, the fewer positive results we'll have. This tweet here: I woke up with a fever, cough, chest pain, and sore throat. However, I'm not eligible to be tested for COVID-19. I was just told to self-isolate. I think there's some confusion for Quebecers. They're wondering who can get tested, where can they get tested. This person says he was told that because he wasn't in contact with anyone that had COVID-19 symptoms, he was told he couldn't get tested. What's the truth here?
That's a problem. Thank you for this information. I would like to know where it happens, because I want to correct. It's clear that even asymptomatic people who want to get tested must be tested. Actually, there is even clinics waiting for patients, and they are not coming. So if you want to be tested, no problem. If you have symptoms, it's clear you must be tested. I will make sure that this information, and my Premier and my minister told us that they are not happy with the rate of testing we're doing in Quebec. We are launching a new strategy with asymptomatics that will prepare us to have a big capacity of testing when cases are going to come back, and perhaps my minister wants to add on this.
Well, I think it's clear that it's roughly 6,000 per day. This is not enough, and there are many reasons for that, and probably the middle of the summer explain part of it, and people that have a sense of confidence, but it's a false sense of confidence. We should not base on that to make sure that everybody that wants to be tested should be tested first. What we've asked Dr. Arruda with my deputy ministers to make sure that we have a plan, because we are not testing enough. And we are not testing We will look into the next few days as to how we can look into certain region. And I take the example of what's happening in the bars, for example, in the Laurentides. What should we do with those regions? What should we do on the Grande Allée in Quebec City? I think we have to look by region. We have to look also at the border, because we know that this is going to be an issue during the summer between the States and Quebec. And so we need to look at how we can increase the number of tests and not waiting for September. So what we've discussed in the last few days is really to go for a plan to go back to our objective by the end of this month. So there is really a clear path of action to go there.
Okay, you mentioned Laurentians. A question for either Dr. Arruda or Mr. Legault. In Laurentians, in the Montérégie, some hospitals as well, in the townships, on the weekend they were at above 100% capacity in their emergency rooms. A lot of people are coming back after, I guess, staying away for so long because they didn't want to déborder the hospitals. Are there any special measures or concerns about too many people coming back and maybe overflowing, I guess, the emergency rooms? Any measures in place to prevent that?
Well, I can probably just tell you that we've seen those numbers in the emergencies, as you're quoting, especially in Montreal and certain hospital as the one you're talking about in Eastern Township. I think it's a bit normal that we see this increase because people were scared of traveling, they were scared of going to the hospital. Now that there is a sense of confidence, and I'm quoting sometimes a false sense of confidence, people are coming back to the emergency. So it's normal short term that we see this increase. But what I would like to tell you is that our goal is still to make sure that we're going to manage those overcapacity. And I'm totally in line with what previously Madame McCann has done to make sure that we have all the new arrangement that we have with the specialized nurses, that we have with the pharmacists, and all the things that we work on the first line, they will have also an impact on the emergency. So I think I would be very clear. It's normal that we see this increase at this time, but we'll make sure that we're going to work with a clear plan to make sure that midterm those emergencies are at the level that we have committed during our campaign a year ago.
Docteur Arruda, les médias francophones voudraient que juste vous répétiez votre réponse en français, s'il vous plaît, sur le dépistage et les tests.
Could you repeat your answer in French, please, on the screening? In French? Okay. So what I was saying earlier on is, if you stop somebody who has symptoms, was refused the test because they were told to stay at home, because they had not had any contact with anybody else. It is not at all an orientation that we have right now. On the contrary, people who have symptoms have to go and have to be tested right now, particularly if it's symptoms compatible with COVID-19. And a patient who would be asymptomatic for one reason or another, who might have been exposed or thinks that they were exposed or wants to get tested, there is no refusal that is made right now. There shouldn't be. If there are, it's a problem because we have screening centers that are open right now, and right now they can't even fill their, daily numbers. They're open, but they're waiting for patients. So I invite the population to go get tested. And as I was saying, our Premier and my minister, we consider that the tests that we're doing right now are not at the level that they should be at, and we are working right now at a new strategy for testing. The minister talked earlier on about an approach with healthcare workers, of course, but also at the borders and with certain, regions where there is a problematic situation, where there might be circulation, interventions in bars, etc. I completed for you, Mr. Minister. I don't know if you wanted to add anything.
Bonjour, René Brumer, Montreal Gazette. For Dr. Arruda, with the increase in socializations that we're seeing, people going back to bars, going out, there's a worry, of course, that we could see a bit of a second surge. At what point does Quebec say we have to go back to certain confinement measures, and in what order could that be? Do we start with shutting the bars again, the restaurants? Is it at 200 cases a day, 500? How do you decide?
It's a combination of factors. First of all, the thing is that we know that with the confinement, it's normal to have a little bit cases and a little bit of hospitalizations. But the important issue is to make sure that we search and contain very fast and be able that the outbreak not being 40, 50 persons, but stay at the level of 10 or 15 by testing, by making people in isolations. So that this is the case. But as soon as we're going to see, I would say, those kinds of flaring up, we'll go very aggressive case contact tracing, testing. And if we think it's a pattern coming everywhere or too much to places, we would probably have to stop that thing. Like I would say, if bars do respect the 2 meters distanciation, the rules that we put, the risk of being in there will be like in a restaurant, and it's okay. But the problem is when you go away from those rules. And we have inspectors of CSST, and we'll make some checkpoints, because we should not tolerate those kinds of situations, because some others will say, oh, if he does it, I can do it. So, and it's going to be an epidemic of bars being a party, which is very dangerous, because we don't want to have, we're going to pay. We're going to all pay for that. And it's why I think I'm inviting the proprietaire, the owners of the bars, and the employees, and the clientele to respect those rules, because that's, if it's a place for getting, I would say, outbreaks, we'll close them.
And if I may, I believe Toronto's mayor today is going to ask that people in all indoor spacing have to wear masks. Why isn't Quebec, or at least Montreal perhaps, going in that direction?
I think my premier told the information. We are going step by step, and we'll see. If there is, I would say, a non-commitment of people to wear the mask at a high percentage in the population, we will have to take those kinds of decisions. But I think that, when you make things mandatory, there is always side effects, and the best thing is that people understand, and I'm very serious, please wear your mask. I know it's not normal. It should come a reflex, because when it's going to be circulating here in the fall, that's going to be saving lives.
We'll take a last one.
Hi, Felicia Perillo from Global News. Question for Monsieur Dubé. The CS West de Lille, they spent $140,000 in 20 days in April on an outside communication and crisis company. In your opinion, is that a responsible use of taxpayer money during the pandemic?
Well, I would probably have to look into that particular spend to see what it was spent for. So you can understand that I need to look into. But I think, as we've seen, and my general comment would be that if they did that, they used their judgment and they made sure that it was done for the right reason. But you would allow me to look into this before I make any additional comment.
But there is these consultants are making hundreds of dollars an hour. Meanwhile, there are frontline workers making about $20 an hour during this crisis.
But that's the reason I'm making the assumption that this was made with a good judgment. But you would allow me to look into it just to make sure that I understand the situation. Okay. Thank you.
Merci tout le monde. Bonne journée.
Thank you, everyone. Have a good day. Don't forget to wear your mask.